Q&A.
Good morning, and thank you for being here. Apologize for my delay. I'm Commissioner Pouet with the City of Dallas, and I may have missed this, so if I did, help me out here. I know that a lot of times physicians, when they speak to their peers, they understand the terminology and the abbreviations. But in our community, sometimes we have to speak to our constituents in layman terms. So when you mention multidisciplinary or multi-physicians, possibly tell them, like if you see your PCP, then an oncologist. You mentioned missing the window, but then to me, the double-edged sword is, what if they're in the window, and since there aren't that many individuals who are either organ donors, and as you mentioned, there's a small amount of people that don't have the livers. What would be any additional resources to offer to a patient who's dealing with liver cancer? And also, are there any resources that you may list here? Because I see UT Southwestern at the bottom, and we do have UT Southwestern here in our District 3 and District 8, right here by Redbird Mall. Are there any other physicians who you can not necessarily recommend, but tell them where they could go for treatment, who they may be able to identify with? Because a lot of our constituents have Medicaid and Medicare.
Yep. Okay, I guess I'll say a couple of things. The first is, in terms of resources, there's a lot of resources. And I think, patient advocacy groups like Blue Fairy have done a fantastic job of having, to your point, like lay language resources in terms of understanding the disease. I will say all of us tried to have lay language today, I think, and it's hard, right? I mean, like, it's the type of thing where when you speak French for so long and they're like, speak Spanish, you're like, oh, I think I can figure it out. And so, like, I think we're not great at it. And so even simple, quote unquote, simple terms that we use all the time, multidisciplinary, you're like, people don't understand what that means. You're like, you need to say multiple providers. So, like, I know we need to improve. And I think that's where, like, I think, once again, patient advocacy groups have done a fantastic job of vetting this in terms of what is understandable language across the board. So I think that's where I would really try to go. Unfortunately, and I think to your point, there's a lot of misinformation out there. And social media, while it's like quote unquote fun, is a terrible place for medical information. So, I think that I would stick to patient advocacy groups, American Cancer Society, these vetted medical groups to get the medical information. Social media and like news agents, many of these are now just like, they're trying to get clickbait. And they don't give you sort of the averages anymore. They give you often the extremes, because that's what causes people to come in. So that's sort of like what I'd say for the resources and the medical information. In terms of like where you can go, I will say, I'm not to have perfect be the enemy of the good, but I do think it's quite important for patients with liver cancer to get an evaluation in a multidisciplinary setting. And I do think that, like, even though the sort of access may not be optimal at all times, many centers will get you in. I mean, we have continued to work with UT Southwestern to get all liver cancer patients in a timely manner, right? We continue to work this in, because I don't think it's right to say wait 2 months to get a visit. That's unacceptable, right? And so we continue, and I think that this has been one of our key things, is to improve our access. So, I take this with a caveat, because I work at UT, and I strongly believe in our program. While I believe UT Southwestern is not only the best sort of campus to receive liver cancer care here in Dallas or the state, I think it's actually one of the best in the country. There are other multidisciplinary sort of centers in Dallas, right? So we have Methodist, we have Baylor as other transplant centers that can offer sort of good liver cancer care. Once again, second to UT, but like, you get the point. The other thing is, for lower socioeconomic status, so the Medicaid patients, the patients who may be uninsured in Dallas County, Parkland is a fantastic resource. And so Parkland, as for those who don't know, offers care for sort of those who do not have insurance that allows access to some other centers. And honestly, the interesting thing is that all of us work, like, Parkland is staffed out by UT Southwestern faculty. So it's very interesting, because I will see patients on the Parkland side that are like, oh, if only I could go to UT. I'm like, outside of liver transplant, you're seeing the exact same providers at Parkland than you do at UT Southwestern. So you get the exact same recommendations, you get the exact same care outside of liver transplantation. Liver transplantation, to put it in perspective, is an $800,000 procedure out of pocket. Now, I could go off in terms of like that is the healthcare system being completely broken, but it is an $800,000 procedure today.
I thought it was $1 million, so I feel a little better. Yeah,
That's the UT discount of $200,000, I guess. But it's an expensive procedure, right? So like when a patient's like, oh no, I can do a GoFundMe, I'm like, it's a different level, right? It's just the unfortunate thing of like that's what they sort of. So anyways, I think the idea here is like you do need insurance coverage for liver transplantation, and unfortunately, Parkland Financial Assistance does not cover that. So that is one thing. Now Medicaid. There are some centers that will take Medicaid. So Medicaid isn't a transplantable sort of insurance plan. So I think it's just working with your physician to sort of figure out the landscape. But I think what I'm trying to caution against is going to see somebody that's in the community and expecting that to be a multidisciplinary sort of opinion. It may be the right treatment for you. I just think that you need that multidisciplinary opinion before you start to do so. UT Southwestern, Baylor, Methodist, et cetera, does not have the capacity to care for everyone. And in no stretch am I saying that everyone needs to be treated in that setting, right? Because I think that it is a partnership between community providers and academic providers. So you will see people who are seen here that live 4 hours away, and we're like, you don't need to come here and get your infusions. You should get your infusions locally, and we will help sort of like from the intellectual perspective.
That was just one thing I was going to add is we do see many patients that transportation is an issue or that live 5-6 hours away or even in another state. And I think, they don't, as Dr. Singal was saying, they don't have to have every visit with us. We do a lot of telehealth. So I see a lot of patients where they drive to see me, or it may be a burden to come once in consultation, but then we coordinate everything else locally. So they can have their scan done locally. We get the discs, we review it at UT Southwestern. They can have their labs locally. We can work with their community doctor, their local GI doctor, their local PCP. So there are ways that we can have access to patients. And then just like Dr. Singal said, Medicaid is not a barrier to transplant. It's not that they can get transplant at every center, but at least in Texas, in the past few years, they've been able to get transplant at some center in Texas. We've had some patients that had to go to San Antonio or elsewhere that we can work with them. But in Medicare, we'll cover transplant at any center in Texas.
we have time for one more super quick question, and I thought I saw it was over here, right? Okay.
I just have one other question. So would I be eligible at 61 years old to take the hepatitis shot to help prevent?
So to do what?
Y'all were recommending to take the hepatitis B shot.
Oh, yeah. So the hepatitis B vaccine. Yeah. So I think it'd be important to see if like you have been vaccinated. And so, you know, there's a test you can do, a lab test that says, do you have antibody to hepatitis B? And so then what they would do is probably start to see if you've been vaccinated or if you've been exposed. And then if not, yes, you're eligible to get the vaccine. The vaccine can be given at any age. Now it's typically given at this exact date, like in a neonatal fashion. So like, you know, babies that are born in the U.S. are typically vaccinated. But yes, you're eligible to see if you've been exposed or immune. And if not, you can get the hepatitis B vaccine. So we typically will do this for folks in our practice, particularly understanding if you have underlying liver disease and then are exposed, like that sort of dual exposure does increase the risk of, you know, liver failure. And so that's why we typically will be particularly on top of vaccinating people with chronic liver disease.